From the Mayo Clinic, please welcome Tori Utley.
Addiction doesn't care about you. Addiction doesn't care if you're homeless or if you're the president, if you're a wealthy CEO or if you're struggling to get by. And it certainly doesn't care if you think you're an addict or not. Addiction does not discriminate. Every year in the United States, the National Institutes of Health estimates that over 23 million people struggle with addiction, yet only 10% receive the help they need. With a deficit of over 20 million still struggling, what will we do about this healthcare epidemic that is killing our fathers, mothers, children, coworkers, and our friends? The word addict has been met with a resounding consensus in our culture. When you are an addict, you receive the scarlet letter A. Your morals are questioned. Your identity is marked indefinitely. You cannot escape this fate, and so those struggling stay silent. The consequence following disclosure is too great. Tell someone and your reputation changes. Your life changes. We are close to something monumental in our fight against addiction. Imagine the kind of ripple effect we would see if this conversation was given mainstream attention, coupled with the appropriate dialogue and response, where long-term recovery support groups look similar and are congruently respected with support groups for those managing lifelong chronic health conditions such as diabetes. By giving this issue respectful airtime, we demystify the lie that all addicts are bad, that all addicts are felons, and that all addicts are just going to use again. You may be thinking that we have made these changes or that there are numerous resources to help addicts get sober. To these statements, I would agree. However, I would respond with the question, how effective are these resources if there is still so much hesitation to use them? Addiction does not discriminate, so neither can we. When we make the word addict synonymous with criminal, we are furthering the stigma that keeps the us and them mentality alive and well. We confine addiction to where we are most comfortable keeping it: in prison, in poverty, out of schools, and out of our corporations. We reject the fact that our politicians, our doctors, our lawyers, our teachers, our families, we all struggle just the same. And further, the message we send to those who have struggled is this: once an addict, always an addict, only an addict. We are all affected by addiction in one way or another. Whether we have struggled personally, have had a family member or friend who has struggled, or have driven on the road simultaneously with a drunk driver, addiction is a multi-billion-dollar public health issue. Addiction doesn't care about you. Addiction doesn't care about your future, your family, your reputation, your job, or the safety of others. Addiction is vicious. It is vicious, just like the many health issues we see every day in our clinics and hospitals. However, our response to those issues is aggressive, rigorous therapies that put our patient on the best road to success. Colleagues, we are not putting our patients struggling with addiction on the best road to success if our minds are made up before they sit in our hospital rooms that they're only an addict. Healthcare, we are an industry of rigor, of innovative thinking, of power, and of change. Today, if we want to make a dent in the 20 million still struggling in an active addiction that could kill them, then we need to start with the fundamental solution that empowers us to change: mind change. We create stigma by allowing it to exist in our minds. The conversation that takes place in our minds holds great power to either help or hinder. We must grasp the power that our minds possess, because mind change is the solution to close the gap between community and healthcare, patients and providers, stigma and respect. If we adjust our minds, we will revolutionize the conversation about addiction. We are the solution. In 1910, Dr. William Mayo said, "The best interest of the patient is the only interest to be considered. And in order that the sick may have the benefit of advancing knowledge, union of forces is necessary." If we are going to get ahead in our fight against addiction, we each have to do our part towards a solution. We must change our minds, and in turn, we will begin the ripple effect that will move to improve health outcomes and quality of life for millions of our patients. Addicts can and do recover. To power health and tackle stigma, we must change what we believe, the way we think, and the way we interact with the world. Today, by changing your intrinsic belief about an addict from the very place you sit, you can change healthcare. Thank you.